tell you exactly what the skin is. And remember that in Genesis, the Bible says that God created human beings in his own image. In the image of God, he created them, male and female. I know that nowadays we're talking about difference, so people don't know they're male or females anymore. But let's leave that aside for a moment. And I like this psalm, and I use it a lot. I praise you because I am fearfully and wonderfully made, and your works are wonderful, and I know that full well. So my problem with most of my patients is that if they really know that, they wouldn't play around with what God created them with. It's a very important thing. It's very important. Quick facts about the skin. And before I go any further, I must say, full disclosure, I will bring you not very pretty pictures. The reason why Dr. Mado put up this projector is because we want you to see the pictures, to really see the skin. The skin does not lie. It is the largest organ of the body, makes up at least 70% of our body. So it's hiding the heart, hiding the liver, hiding the prostate, hiding the kidney, hiding everything. And yet, simple thing that God told us to do, just take care of it. We are not really doing that. I'm not trying to scare people, but I will give you a few hopeful truths. If you take the entire skin, remove it, and put it straight out, it actually weighs, it's about 20 cubic meters, and it weighs 77% of the total body weight, particularly. That's twice the size of the brain. But I know a lot of people who say the brain is more important. God works completely, impartially. Every part of your body works for the next part of the body. They are all working in harmony. It's like a beautiful orchestra. Everybody is important in that. The skin should not be neglected in the process of that. And when we talk about dermatology, we talk about the skin and its appendages. It includes the hair, it includes the nails, and it includes the mucous membranes. All these are part of my purview. They're all part of the skin. And I was talking about the container. So if you spread your skin, it contains about 20 square feet. What does the skin do? Why is it so important? I merge most of these functions together just so that we can really remember. It covers you. It's like you have a house, a carcass, and there's nothing inside it at all, but you've just built the house. That building, so to speak, that structure is very important, because imagine if you made the house and it doesn't have walls, it doesn't have roof, it doesn't have anything. All the elements are going to be inside that and literally will destroy what's inside, right? So the skin provides that protective barrier against so many things: microbes, insults, oxidants, so many things. It reduces the harmful effects of the sun. The sun is good for us, but too much of the sun or the wrong kind of UV, ultraviolet, is a problem. And if you have a problem with your skin, you won't be able to feel sensation, you won't be able to touch, you won't be able to sense things. That's a problem. It has its aesthetic properties because the skin, if you come to my clinic in Yaba, patients who think they have a skin problem see other people's own and they think their problem is not so bad, they run away. It actually is so visual, you can't hide the skin. I don't need too many investigations to tell me this is a problem. The skin will not lie. So if you cover, even if you want to cover from top to bottom, by the time you're coming to the doctor and you show me only this part, and I say take everything off, actually, Yorubas will say the secret will be exposed. It will not tell a lie. Now, a lot of people talk about types of skin. You say there's normal skin, there's oily skin, there's combination skin, there's dry skin. It doesn't really matter which one you have. It's how to take care of each one that really matters. So what works for skin A may not necessarily be good for skin B. What the one thing they all need in common is moisturization. Imagine going to the market and you want to buy a fabric. Some of it is silk, some of it is rough wool, some of it is like fine cotton, some of them have 300 count rate. They all differ. And how you take care of that difference also matters. The environmental aspects of it is very important. What you put in, what you put on top, external and internal, all very important. So these are different properties of the skin, of types of skin. And this is colloquial. Medically, we talk in terms of phototyping of the skin. How does one burn? How does one tan? But lay people will just say, oh, I have oily skin, I have sensitive skin, I have combination skin. What should I do for hair? Some are dry hair, some are oily hair. Some of the face is very oily, some of the body is dry. And because of that, most men do not moisturize because they say they produce enough oil, or they work in NNPC or Shell, as the case may be. So basically, if you look through that, I'm just going to leave it there. I don't really want to talk about it. But let's take dry skin, which is usually one of our problems. The skin does not like to be dry. There is a natural moisturizing factor that God puts in every single person. As you age, you lose that. But even if you didn't lose it, so to speak, you still need to put something on top, because every single element, the elements, wind, weather, air, sun, they take off from what is natural to you. So you kind of have to replace it. You must eat even though you know that you have enough, because you are replacing something that has been used. And these are the problems with dry skin. Aging, I talk about weather, and some people will bath for Nigeria. Some people think that the more they have their bath, the cleaner they think they will become, or maybe they want to become whiter. I don't really know. And I tell people, you don't really need to bath that many times. The type of water in terms of temperature also matters. What I'm doing is a bit of an overview, because I'm trying not to scare too many people, and my task is to make you remember your skin. I think that's what I'm supposed to do here. And some of soaps you use to bath, and cleansers, and the ingredients in them, and then medication. You take drugs for something, it's causing another problem. And you wonder, you come into the clinic and we're like, oh, you must be taking these antihypertensives, and they're wondering, are you a juju man? I'm like, no, your skin is telling me something. It's speaking a language to me that I need to understand. I need to make you understand. Women go through a lot of hormonal changes. So one minute they say, this is what has always worked for me all these years, and now it's not working for me. You are changing. The body is not static. As you change, your body changes. Then people talk about sensitive skin a lot. And everybody's like, oh, my skin is sensitive, I can't use this product, I can't use that product. And we are wondering, why is it sensitive? What have you done to the skin to make it sensitive? Nobody is born with sensitive skin. So it's usually a result of your actions. That's the honest truth. However, changes in weather, you move from one location to another, can make your skin react sort of differently. So this is what I was talking in terms of skin phototype, by virtue of dermatologists and how we type the skin so that we know what happens to you. So you can tell that the people, the very fair is like the Irish people, they always burn, they don't know how to tan. And we in this part of the world are like 5 and 6. We tend to not burn, and we always tan. Even dark people tan. Sometimes if you've been out in the sun for a very long time, you find that you're darker. So don't think that because you have a lot of melanin in your mind, everybody has the same melanin number. We white and black and orange put together. So what is healthy skin? What do we mean by keeping skin healthy? What do you think? Is it for skin to be free of blemish? No answer. Reflect light, supple texture. We don't want any discoloration. We want to be wrinkle-free. We want to be scar-free. We want a skin that doesn't smell. If we have all of this, is this healthy skin? Yeah. Supposedly. So that's, in a way, it is. However, for me, healthy skin is a skin that performs all the functions as I mentioned before. And truth be told, if your skin is able to perform its functions, it will reflect all the things that are right. So that what you were all looking at was just the aesthetics of the skin and not the physiology, not the function. Does that make any sense? So that is healthy skin. And for you to continually have healthy skin, you mustn't insult your skin. Because a skin that is insulting can also fail. We've all heard of heart failure, liver failure, stroke, which is like brain failure. The skin can fail, and it's not because we want to be among the people that are failing. We actually can fail as well. And these are the sort of things that when we talk about insulting the skin. Dr. Mado has been talking about oxidative stress and cancers and pollution and diet. Everything is talking about those diseases that you may not be able to present, which are autoimmune, and infections and ultraviolet damage can all insult the skin. All of them have a final common pathway to break down the skin barrier, to break down its immune function, it will not be able to do its God-given duties, and the skin can fail. So those are the things I'm talking about. And when we talk about a rash, what's a rash? A lot of patients tell me that's why I have these rashes. Everything is a rash. What is not the normal thing is a rash. The skin has a limited number of responses it can do to any insult. It is either it is red, or it is swelling, or it will itch, or it will be discolored. So if I, for instance, slap somebody, that's a physical insult. They will be red and swollen and it will hurt. But if they have a trauma, like maybe a burn, it's the same thing. If they have a disease, it's the same thing. So it's not what shows on the outside, but the story behind that visual thing. That is what we talk about. And I say that it's important for us to know that story because the secondary things, the things people go to do when they have a skin rash, gives a different story altogether. So you need people who can speak. And so see, I'm giving examples of limited skin responses. These two things look the same, true or false? They are not the same. One of them is a genetic problem, the one on the left, to my left, correct? And then the other one is simple acne that she got from bleaching. We'll go into that. I'm very sorry, I apologized at the beginning, but these are important. These are also two different things. The one on this side, she caused by doing certain things, and the other one is a poor young child who has an autoimmune problem. You see, they look the same, but they are not the same. And what happens is that, I'm going back, the parents of the other child will do abo and bring skin failure to us. The importance of doing the right thing cannot be emphasized. So skin failure is there, and we have that definition of the book. When the skin is not able to do all its functions, it fails. And when your skin fails, your heart fails. Remember I said it's the covering of everything. When your skin fails, your liver fails, your kidney fails, everything just goes all right because they all want to work in concert. Skin across the ages, what you were able to do at 35, at 55, you will not be able to do. So you might need to supplement it as the case may be. But supplementation does not necessarily mean medicines. It's actually exercise, good diet, water, and a lot of other things. Just a quick word about skin lightening. We must talk skin lightening. Oh, I have a blemish. Use this for your spots. My doctor gave me that day. Oh, it works for my jacket. It's going to work for this one. It works for my father. It's going to work for me. I want to glow. I want to maintain my skin. All of that is not necessary. I call all of them frightening things. Skin whitening, skin lightening, skin brightening. They are all a problem. And if you go to the market, oh my God, there are too many. The cosmetics are a problem. So we talk about cosmetics as a very great insult. Ephesians says that we should put on the whole armor of God. Yes, but not the shield of layers of foundation. Not the breastplate of body magic for women and some men, the body magic is there. Not the helmet of wings. And not the sword of stilettos. They are a problem. They are a problem. So the cosmetics can, yes, I'm wearing stilettos. Thank you for noticing. I'm very short, I needed you to be able to see me. So the cosmetics can cause oxidative stress. Oxidative stress is the bane of cancers. That's the honest truth. When we do things that will not allow our skin to breathe and take the right oxygen to, oxygen is life to the cells, to the tissue. Anything that is going to reduce your oxygen content is going to cause you trauma. So the reason we talk stilettos, every time you walk and you're not very comfortable, luckily I'm small so I can take it, but there is oxidative stress on your muscles. It's tension, so you're going to have a problem over time. When we talk color, I want to be black, I want to be white. When you try to buy your color, you tend to have a lot of problems, including what we call the body sign, roasted plantain. Do we know it? You don't know the body sign. You can't see. Body, roasted plantain, half burnt, half cooked or something like that. And they also do not smell very nice. They have all manner of skin problems, and the deadliest of all is that they actually can cause cancers as well. And that's basal cell carcinoma. Even though that's a picture on our binary sheet, we have them even in black skin. People used to think that blacks don't have cancer. This is not regular pimples, it's from steroids. This is not regular fungal infection, it's from the use of skin lightening. It changes the color, it changes the way it even presents. It disturbs us from understanding the language of the skin, which I call skinese. Chinese, Hispanese, Japanese, I say skinese. If the skin is not telling me something, then you have altered it. And we look at this. Can this patient have diabetes? Or is it HIV? But the patient didn't have any of those. The patient got this disease. It's extensive fungal infection from the use of poor moisturizers, skin lightening. They all have steroids, they have some mercurials. It is happening every day. Unfortunately, this patient will be wearing clothing and going up and down, and nobody has an idea what she is carrying. And look at this again, the pregnant woman who had also used a lot of skin lightening. And compare with this picture, the man who is not pregnant, but he came down with Cushing syndrome. He was getting ready to fail organs. Again, skin lightening is the cause of this problem. Although he also had a metabolic disorder, because it's on the big side, and we have talked about weights, we talked about trying to do the right things. Oh, look at this one now, this lady. What can be wrong? You have all that discoloration in the back and it's itchy. Could be dermatome, that's a big problem. I'm not going to confuse you with brain disorders. She said it's bleaching. Part of it is bleaching, but she also has a metabolic problem. So the issue now is that depending on how you treat your skin, you come down with more problems than you plan to have. So my take here is that what do you not do? What should you not do? Because we all can be dermatologists, we all can be physicians, but you have a charge for your skin. What can you not do? It's trying not to do triple action. One cream fix all the problems. Antifungal, antibacterial, anti-inflammatory, and they tell you it works. Globally, they say in Yoruba. Antiseptics and disinfectant soaps are actually not very healthy for you because they dry out your skin, and a skin that is dry will scratch, so to speak. When you scratch your skin, you break your skin. When you break your skin, you introduce bacteria, and so the cycle continues. Herbal concoctions. Everybody is doing something now. Everybody's adding and subtracting and using all manner of stuff. We need to be really careful because they're coming down with so many allergies that some of them we can't even understand. It's bad enough that you drink it, some people apply it, and they do for children who cannot say no to their mothers. Please, please, it's very important that we stop mixology. On YouTube, on Snapchat, this generation is talking about using natural products. Quaker oats of yesterday and papaya of tomorrow and lemon and mix it all together and apply it and do all manner of things. It causes too many problems. Please respect your skin. What should we do? You see the beautiful colors all of them. When we talk about eating right, we talk in terms of the quantity, the quality, the timing, and I talk about the color. Every foodstuff, natural foodstuff that has bright reds, oranges, and greens, they are rich in antioxidants, vitamin A's, vitamin E's, vitamin C's, zinc, and selenium, and they are free radical busters. So all this cancer we are worried about, they are busting them at the seams, and you don't need to take all manner of multivitamins to get them if we eat right. And we are lucky in this country because we have fresh foods a lot. It's not for you to go to the supermarket and buy all of the canned vegetables. They are fresh. Luckily, we don't even have power. So, buy them every day because we put inside your freezer. The freezer has started to cover. If there's no light in the house. If Hippocrates said it's like, food be your medicine and let the medicine be your food. That's not to say when the doctor tells you to take medicine, don't take it too. I didn't say that. A broad spectrum sunscreen. In those days, they used to take that blacks. That's me. I'm trying to show you that I'm practicing what I'm preaching. That if we, in this country, because of our melanin, we don't get cancers, it's not true. It's not true. We have cancers. We have a different type. We may not have melanoma the way they have in the Caucasian world, but we do have cancers. Skin cancer was not in the probably very tiny sliver in the slide that Dr. Nadu showed, but we get different types of cancers. And some of them have not only skin deep. It will show in the skin, but it's coming from inside. Okay? Avoid direct sunlight. Wear sunglasses, you can make shakara with it, it's fine, but you know what you're doing. Wear a hat as much as you can. And the men can wear it, it's not women, it's not only women. Okay? Don't smoke. Nowadays everybody's doing shisha. You don't know shisha? The pipe thing, that's it. He mentioned don't smoke and don't be in the smoking environment. Yes, so you can be in the bar, you're doing shisha, you're not smoking, but it's all there. It's polluting your environment, antioxidants, free radicals. It's a problem. Stay hydrated. Some people don't know how to drink water. It's very, very important. The formula for water is H2O. O is oxygen. Take water. Take as much as you can. Wash your skin gently, please. No scrubbing motion. And don't turn your towel into a sponge either. Just be gentle with the skin. I beg you, because I see the skin when it's upset. It can be very upset. Okay, for the women who wear makeup, please try not to wear makeup to bed because it clogs up your skin and your skin can't breathe. Moisturize. Anyhow you want to apply it, moisturize. Simple, straightforward petroleum jelly is fine. That's the honest truth. You don't need anything esoteric, you don't need anything extra, you don't need anything expensive. People are talking about using oils, coconut oil, shea oil. Oils are not effective moisturizers. They are occlusives. No. The only way oil will moisturize you right is if there's already some water on your skin. So immediately after you've had a bath, you can apply your oils. It traps the water. And remember, we're trying to do moisture. Okay? Moisture is not creamy. It's water. And the same thing applies to the hair. Remember I said that my specialty is about skin, hair, nails, mucous membranes. Everything is the same. Moisturize and sleep. In traffic, if you must, but sleep. If you must, just sleep. You have to sleep. He said 6 hours. Honestly, when I don't get the right amount of sleep, I'm not a nice person the next day. I don't smile easily. I struggle, and my students will know that there is a problem. She hasn't slept. You need to sleep. You just need to sleep. You need to sleep right. And you need to sleep completely, not sleep for every minute you're checking the time or your alarm is going. And in doubt, whenever you're in doubt about the skin problem, seek the right counsel. I know that I'm the lawyers. I'm not asking for lawyer counsel. It's my counsel I'm talking about. So in conclusion, I just want to say that the skin is a very good disease indicator. As the largest organ of the body, it's a window to the discerning eye. So from a distance, I can see a patient, and by the time the patient is talking to me, I'm already moving like this, but I will listen. Because I understand what the skin is telling me. And if you haven't altered your skin, we will be speaking the same language of skin is. So like I mentioned, that one rash can be many diseases. It is the story behind the rash. So we call ourselves, my clinic is in Yaba, on Harvey Road, and I say that it is CSI Yaba. For those who watch CSI, Crime Scene Investigation, we are the medical detectives. So we see a problem, they say, no, it's the pancreas that has that problem. You show me, I said, it's the endocrine system. You show me one, I said, no, it's the brain. We are medical detectives and we will take it. So if you take care of your skin will take care of you. And when you have a problem and you take it right, we have solutions. And they are happy with us. Thank you for listening.
It was very enlightening. You told us about plenty of fruits, we all know that. And then you get a lot of information where they say that don't take fruits when you have eaten. Take fruits before. And they actually even go further and say that if you take it, it becomes poison in your body, it causes cancer. So you hear people saying this, another will say that. So if you can please just clarify for us.
To a large extent, most of the water that is used here is polluted. If it's not from the well, it's from the boreholes. Except if you live in the city where you have water from the waterfall. Now, you have soaps like the Tall soap. I'm not marketing for any other, but you have soaps like the Tall soap. You have Bergama, you have Pierce baby soap. Now, what is your recommendation about those ones? Because quite a number of us are used to specific soaps that we think are safe. Like the Tall soap, like baby soaps. So please, I need your advice on that. Thank you.
Please, I'd like to know
the effects microwaving has on our foods.
Then, is it part of skin problem? If we talk about it, if there is resistance dandruff, what do you do? Thank you.
Speaker talked about covering, stress, pressing, non-exposure. Wearing belt, wearing pants, and wearing leggings appear to fall into some of the causes of this thing. So, talk to us about it.
For me to believe that there are some diseases inside that even when you cure outside, they will always tell you that you need to cure it from inside. How do we marry this together?
Okay, I'll take you, and then I'll leave Dr. Madam to take the ones about cancer. Let me just start. Thank you very much for your questions. That's actually very encouraging. It means that we carried everybody along. So I appreciate that. Thank you so much. So antiseptics and water being polluted in your environment. Now what I tell everyone generally is that when you talk about water pollution, are you talking color of the water in terms of it's looking browny, which usually means high iron content, but not necessarily pollution. So if your water is smelling or not, the ideal thing actually is to boil the water to be clean. Pouring all the number, if you put a whole bottle of Dettol or Purity or Salmon inside your water, it's actually not going to make any difference at that point in time. And then if at all, it will be even more counter-effective to you. So in the days, the areas where you don't think your water is, either you boil it, which is better than boil and then keep it. So you just find a way to get rainwater as much as you can filter, but not giving, Dettol is not the answer. Because it pushes your pH to alkaline when you have an acid pH, and that brings in more problems. So that's where the issue is. So bioderma, pairs, and all that. Bioderma is fine, pairs is fine, maybe soaps are generally fine. The problem with giving names is that the practice nowadays is mothers, and they are being told by, I think, some healthcare workers, that they should add triple action creams to their baby creams. Yes, supposedly to keep the children or the babies in the color that they came ex utero. As you know, usually when babies come out, they are seemingly fair, and they say, oh, to maintain that fair color, we put in formaldehyde and skin inside the body. That's what is happening. So we tend not to use product names because the problem is don't just show it at all. So when we talk in terms of products, skin products to use, I tell everybody that if your product says brightening, lightening, whitening, frightening, I call them frightening, clarifying, they are a problem. That's the honest truth. Because more often than not, they're not telling you everything that you put in there. They tell you, oh, it's just to keep it fair, it's just to keep it bright, it's to maintain the skin. Euphemisms are the same things, please. So I think that answers your question in the manner of speaking. Okay. Dandruff, I talked about the fact that the skin and its appendages being hair, nails, and mucous membrane. So dandruff falls under the purview of skin quite a lot. But what you may call dandruff may not necessarily be dandruff. We actually need to have it checked because thick flakes on the scalp may end up being something like psoriasis or seborrheic dermatitis or seborrheic psoriasis. So you might just be saying it's dandruff, and when we check for that, actually it's more than that. Probably need to have it checked. Friction, very good question. Friction of belts, pants, and leggings. I don't know that the men will have this problem too much, but most ladies, well, some of the men are wearing earrings. There's a difference between some men don't wear earrings. There's a difference between wearing underwear and just wearing regular boxers and pants and wearing a girdle. That friction, because your skin is squeezed, is equivalent to you being hurt. There's something called ischemia of the skin, no oxygen. When you remove tight clothing, women can bear me witness, you feel as if you want to scratch from down to forever because the oxygen, the blood flow is just coming back there and oxygen is now just being released. So it's as if you have pinpoint stuff. Except you are trying to, I don't know, maybe Miss Nigeria, your belt can never be that tight. You understand? So not likely in terms of belt and friction. Leggings, yes, but there's some leggings that are not jeggings. You know, there's some leggings that are just cotton. So it's just like clothing. But you will know when you're wearing something tight, and that friction is a big problem. But you might also have contact dermatitis from using the belt, so that's another issue. Diseases inside the body. So we talk in terms of the skin being that many tests. However, I may need some tests to buttress what I have already begun to think, to crystallize my diagnosis, so to speak. I think, I don't want to paraphrase you, but I think to a large extent, saying that the problems are always from the outside is not as simplistic. That's a simplistic statement, so to speak. What we are trying to say is that more often than not, the problems that you would have, you caused it. It may be from inside, it may be from outside. It could be what you took in, it could be what you put on. Not necessarily that it's all from outside. Having that's the caveat, because some people have autoimmune diseases that the external environment now brings to bear. So it's a bit of a seesaw. You can actually have both of them occurring together. So it's not necessarily only from the inside. I think the problem we have is when people say they have loudspeaker and they say Staphylococcus aureus is disturbing you, Staphylococcus aureus. Everybody has Staphylococcus aureus. Everybody does. So if you have all of those megaphones and shouting, yes, my problem is staph, and patients will bring and say, doctor says, they said I have staph. I say, well, come, he said I have. What do we want to do about it? So it's not just that, it's more, and that's why we need to also have a discussion. Okay? So the question about fruits, there is no hard and fast rule to fruits. That's the honest truth. There is no hard and fast rule. What we tend to say is, if you're taking the fruit with a high acid content, you need to be very careful because you may actually have that crampy feeling. Okay? And it doesn't mean that when you take high acid content fruit, you automatically have an ulcer. There's all manner of stories out there, it's not true. There's no hard and fast rule about fruiting. In fact, my grandmother would say that, I would say, oh, Mama, you have to eat this one before you eat this one. She's like, why? Put it all together and shake your body to not later. I don't see what the beauty is. You know, these social norms, how we say, oh, you should have first course meal and second course meal, because they kind of ease your body into hard meals, but there really is no hard and fast rule, and there are no studies to show that doing this way and doing that way will make this one better than the other. Okay? And then microwave. Okay. If I were my dad, I would say don't microwave at all. But me being the daughter who is going to be disturbed every time I say, Dad, I'm sorry, you have to microwave. So again, the idea about microwaving, I'm not a technocrat in terms of electronics and all of that. But the truth of the matter is that if it were not safe in the larger environment, we will not be using it. However, it is actually right to do things basic as much as possible. So if you can minimize how much processing you do, that's the problem with microwave, that you are doing over processing and you're not allowing the proper chemicals that are supposed to come out from your natural foods to do their work. That is where the problem comes in. Okay? So if you can avoid it, avoid it, but I'm not the one that's going to say please microwave causes cancer.
With microwaves, most of the antioxidants in whatever food you have in there are gone by the time you are eating it. So our recommendation remains, as much as possible, eat fresh fruits. And they are found in our country. So as much as possible, fresh, you have all the things in the right quality. The more you process, the more denatured, the more damage the chemicals and even the natural foods get. Because if you overcook some of these things, by the time you are eating it, you are just eating rubbish. So, fresh, better.